The District Health Centre of Limbe is located in the southwest region of Cameroon. Until 2012, this healthcare facility, like most others in the country, battled to provide people with basic healthcare services. The introduction in 2012 of a new approach to improve the delivery of health services, called performance-based financing, or PBF, in 4 pilot zones in Cameroon, made all the difference.
I decided to come and to Libya, and I came. It was cheaper, and the people were so caring. They cared for me so much that I'm happy, I'm strong. Sure, I just love the place. The place is nice.
PBF is a new results-based approach to health resources management. Results are assessed according to the quantity and quality of service outputs. Payments are made directly to health facilities upon verification of results. As opposed to the traditional method of allocating funding or material on an input basis, PBF instead releases funds according to the results achieved in order to improve the availability, the accessibility, and the quality of key services and health centres. This financing approach rests on a contractual relationship between the different actors of the health system and on the basis of performance indicators that are defined upstream. PBF funds arrive directly at the point of service delivery, giving more autonomy for the health centres. The staff decides together how to use these funds to improve the functioning of their facilities. This system improves transparency in resource allocation.
Nous constatons que dans les districts de santé où le PBF a été mis en œuvre, les hôpitaux sont propres, ils sont bien tenus, les hôpitaux sont fréquentés, le personnel de santé est motivé. Il y a donc plus de ressources qui sont générées directement par l'hôpital et les patients reçoivent des soins de qualité en payant le juste prix.
Cameroon is a low-income country located in Central West Africa. In 2012, the country was ranked 150th out of 187 countries on the Human Development Index, with the 18th highest maternal mortality rate in the world. The country is unlikely to achieve the Millennium Development Goals. In 2009, the Ministry of Public Health in Cameroon has, in partnership with the World Bank, funded the original Cameroon Health Sector Support Investment Project, a 5-year $25 million project, which aims to support the provision of key maternal and child health services through PBF. This project is currently implementing PBF in public, private, and faith-based organization facilities across 26 districts in the littoral, northwest, southwest, and east regions of Cameroon, covering a total population of approximately 3 million. In 2014, with support from the World Bank and the Health Results Innovation Trust Fund, which was created in 2007, with support from the governments of Norway and the United Kingdom, an additional financing of $40 million was allocated to the project to support the introduction of PBF in the 3 northern regions of the country where the poorest health outcomes in the country are found, as well as to pursue the operation in the areas currently covered. In addition to this support, the government of Cameroon is contributing from its own budget to support the rollout of PBF.
PBF is strengthening the role of the regional delegation in implementing government policy. Generally, there is a weakness in our Cameroonian health system because nobody budgets for supervision, and it makes supervision very weak. And whereas what we're seeing now with the PBF, we are able to carry out supervision on a regular basis. It's consistent, and it's giving us lots of good results.
The aim of the project is to increase the use of health services and to improve their quality, with a particular focus on maternal and child health and communicable diseases. Maternal and child health services are targeted by the intervention and include, for example, outpatient consultations, immunization of children, antenatal care services, assisted childbirth, and prevention and treatment services for HIV/AIDS.
Avec la venue de PBF et les conseils qu'ont prodigués les techniciens de PBF, on a réduit la consultation de 5 000 francs à 3 000 francs, ce qui a permis à la population d'avoir accès aux consultations avec le médecin.
In addition, the project provides vulnerable people with free healthcare services. The positive changes that have been seen over the past year across Cameroon's health districts where PBF has been implemented are rather encouraging. Both patients and health practitioners benefit from the positive spin-offs of this system.
I came here because many people told me it's a very nice place, it's the best for babies around here, they give vaccines very well and they are efficient. So that's why I brought my baby here.
I came here because they do their services, it's very good, everything. They attend to poor well, so I chose to come here. That's why.
Akili Mwabi Marie, a senior nurse at the Kumba District Hospital, is very enthusiastic about recent improvements. The financial compensation associated with PBF has also positively boosted the morale of health providers.
The staff is motivated, so they work happily. The nurses are always there. Before we used to have a shortage of nurses, but now the hospital is able to employ some of the staff to work, and there's quite a good follow-up. So even the patients, they like to come to the place now. They enjoy being there. Before it was not like that.
Funds are provided to health facilities only after quantitative and qualitative results have been verified. Muki Ekwi is a PBF quality inspector and conducts site inspections to check whether the services provided by the health facilities meet the norms of the Ministry of Public Health.
Now people know that money that comes in at the health unit, at the end of the month, whatever thing comes out, a certain percentage is shared to the staff. So if you see a staff who is taking money in his or her own pocket, the other person will report because he knows that it's removing the money that they are supposed to enter the common basket and all of them share.
3 years after the introduction of PBF in some areas of Cameroon, a strong increase in the quality and the use of maternal and child health services can be observed. Across all 4 regions of the pilot, the utilization rate has increased, for some services even quadrupled. In addition, the availability of medication has improved. Quarterly quality assessments have shown that the average quality of care in PBF facilities has increased 60% since the pilot began, while the satisfaction level of beneficiaries has increased by 30%.
Based on these results and the fact that now we've learned a lot together with the Ministry of Health and the various stakeholders involved, that we learned how to do it, then we're certainly discussing also with the Ministry of Health of how to scale it up nationally.
Innovative monitoring and evaluation systems set up by the project allows everyone to track results in real time on www.fbrcameroon.org. The trend shows that performance-based financing constitutes a promising intervention that is key to improving the productivity of healthcare services in Cameroon.